Hi there. I'm Dr. Michael Gambello, and I serve as the Section Chief of the Division of Medical Genetics at Emory University. Today we're separating myths from facts about genetic carrier screening. If you're not familiar with these terms, don't worry. I'm here to break it down for you in simple terms. Genetic carrier screening checks to see if you carry genetic changes that could potentially be passed on to your children. Let's address some common misconceptions. Myth number 1. If I'm a carrier for a genetic condition, my children will definitely have the condition. Fact. Being a carrier typically doesn't mean your children will have the condition. For most of the genetic conditions on carrier screening panels, both parents must be carriers in order for a child to be affected. If only one parent is a carrier, children may be carriers themselves but usually do not have symptoms. Myth number 2. Carrier screening is only for people with a family history of genetic conditions. Fact. Most people who are carriers have no family history of the condition. In fact, almost everyone is a carrier for at least one genetic condition, regardless of their family history. That's why carrier screening is valuable for anyone planning a pregnancy. Myth number 3. The testing process is complicated and invasive. Fact. Carrier screening is actually quite simple. It usually involves just a blood or saliva sample. Results typically come back within a few weeks, and a genetic counselor helps you understand what they mean. Myth number 4. If both partners are carriers, there's nothing they can do. Fact. If both partners are carriers for the same condition, there are several options to help ensure the health of their future children. These include IVF, with genetic testing of embryos, using donor eggs or sperm, adoption, prenatal diagnosis, or simply being prepared with the right medical support if they choose to proceed with pregnancy. Myth number 5. Carrier screening is only relevant for certain ethnic groups. Fact. While some genetic conditions are more common in specific populations, like Tay-Sachs disease and those with Ashkenazi Jewish ancestry, carrier screening is valuable for people of all backgrounds. Expanded carrier screening panels test for conditions that can affect anyone. Understanding your carrier status puts you in control of your family planning journey. It's not about limiting your options, but rather expanding them through knowledge. If you're considering starting or growing your family and want to learn more about carrier screening, visit jscreen.org for information that can help you make informed decisions about your reproductive health. Remember, knowledge is empowering, and genetic testing is just one tool to help you navigate your path to parenthood.